So in our concept check for section 1.3, it has you to name 3 products produced by genetically modified organisms that benefit humans. And so if you go back into your book to look for some other examples, I gave you a few examples in the lecture. But there's different things like drugs and hormones are made by genetically modified organisms. Insulin, human insulin. It's even talked about how pigs produce human hemoglobin, which is very helpful. Plants that contain natural pesticides or fruits that do not ripen too rapidly. So if you've ever noticed that sometimes you'll put these fruits out and they won't ripen very quickly or ripen too quickly, that would probably be a genetically modified organism that was genetically modified to do that. So describe one method in which microbes are used for bioremediation. The spraying the oil spills with bacteria that digest oil, that would be one, and spraying toxic waste dumps, Superfund sites with microbes that will remove toxins from the soil. Those would be a couple of examples. So in section 4, we're going to look at the infectious diseases and the human condition. And we can't leave this section without talking about COVID, so I'm going to go to a couple of websites. One of the things that I will tell you is this book was produced in 2018. That was the copyright, I believe. 2021, I'm sorry, 2021. And but the things that they have, the top 10 causes of deaths was from 2015. And so it takes a little while before the book catches up. So we're going to talk about some more recent ones that have happened since COVID. But the learning outcome for this is to summarize the relative burden of human disease caused by microbes. So not all disease, but just ones caused by microbes, and emphasize the difference between developed and developing countries. So I'm going to take you away after I give you a couple of information things to some websites from the Centers for Disease Control and the World Health Organization, and I'll put the links in there. So the pathogens are any agent such as a virus, bacterium, fungus, protozoan, or helminth that cause disease. There's nearly 2,000 different microorganisms that cause disease. And as far as terminology is concerned, we need to understand that an infectious disease or microbes may be communicable, and may be infectious. So what is the term infectious? So generally when we're talking about microbes, they are infectious. And diseases that are not caused by microbes are considered non-infectious. So communicable means that they can be transmitted from person to person. So not all microorganisms can be transferred from person to person. So some things you get by food or water, for example, and so that's not communicable. Communicable means that it's person to person. And again, if it's not caused by a microorganism, it's non-infectious. So infectious means that it's caused by a microorganism. Non-infectious, not caused by a microorganism. So it's other diseases that are, and those would be considered non-communicable. So those are some terminology pieces that we need to really understand here and what that little picture meant. So the top 10 causes of death by all diseases is listed here. And this, again, I looked it up. It's in the year, it was CDC data published in 2016 for the year 2015, and the World Health Organization published the in 2017 for the same year, for 2015. So this is in 2015, way before COVID. And you can see heart disease and cancer, chronic lower respiratory diseases, accidents, unintentional injuries, stroke, Alzheimer's disease, diabetes, influenza and pneumonia, nephritis, nephrotic syndrome, and nephrosis, so kidney diseases, intentional self-harm, suicide. So those are in the top 10 for United States. In worldwide statistics, heart disease is also number one, and it has always pretty much been number one. What does vary are these other two, like stroke and cancer. Stroke used to be higher in the United States. It's now lower in the list. Cancer has risen to number 2 here. And it just, every time we get a new textbook, this list of statistics varies a little bit. But stroke and cancer and heart disease are usually in there somewhere. Lower respiratory illnesses, influenza and pneumonia are much higher up here on the list for worldwide statistics compared to influenza and pneumonia in the United States. Chronic obstructive pulmonary disease and tracheal bronchus and lung cancers, those would be related to smoking. Diabetes is higher here, and then these others related to smoking are higher worldwide than they are in the United States. And then Alzheimer's disease is a little bit lower, diarrheal diseases, tuberculosis, road injury. And so we have usually a pretty good discussion about this during class. So, but I want you to, pause and think about which of these are caused by infectious diseases. And if you look here on this list on the left, you can see, and I'll just kind of highlight some of these, let's see, or underline ones that are caused by infectious diseases. So you've got influenza and pneumonia here, and the rest of these, I mean, there are some possibilities that some microorganisms can cause heart disease and cancer, but other than that, the outwardly most clearly caused by microorganisms would be these two. But over here we have influenza and pneumonia, and we've got diarrhea illnesses and tuberculosis. So there's a lot more that are directly caused by disease here in the worldwide statistics. And here in the United States, do people die from diarrhea? They do not. Usually that's if there are some, it's very rare. It might be like premature babies or something like that, but it's usually not something that is a huge issue in the United States. So why is that? Well, part of the reason why they get diarrhea is because their food and water is not regulated like it is here in the United States, and we have clean, pure water. Everybody has, and it takes advantage or takes it for granted that we have clear and pure water, and we don't have to walk to get to it, and we can run our water all day long. We can, it's just something we take for granted. At least in this part of the United States. Maybe not in western, in Nevada, like in places around Las Vegas or Arizona, where they are having so much growth and they don't have enough water. That may be different. But here in this part of the country, it still is not a huge issue, but it will probably become an issue not too far from right now in the future. So we take for granted that we have pure water, clean, pure water. Influenza, we have vaccines for this. Pneumonia, we have antibiotics. Tuberculosis, we have antibiotics. And also just the living conditions are related to this as well. And we do still see these diseases here, just they're not in the top 10 list. Well, they're the top 10, but they're 8 on our list for influenza and pneumonia. So if you look at just comparing infectious versus non-infectious diseases, like 30% of worldwide deaths are caused by infectious disease. And so that's a huge percentage of the causes of death. And we saw that 3 of the top 10 were caused by infectious diseases. Change in death from 1990 to 2015, we have seen a decrease in infectious disease, like 94% decrease in measles, which is largely due to a campaign to get people vaccinated with the MMR shot. Diarrheal diseases, we've seen campaigns to get clean, pure water to people across countries where they don't, and in areas of countries that don't have access to clean, pure water. So diarrheal diseases have decreased in the last, well, between 1990 to 2015. But we have seen an increase in diabetes, and we do see this in our children. And over that period of time, we've just seen like an increase in processed foods and lack of activity among our children. And so that is increasing. And as those children get older, that's going to be a bigger concern. Current number of deaths, like in the United States, infectious diseases, a really small percentage, where worldwide it's a much higher percentage of the deaths. So if you look at, and I'm just going to finish the section out, and then I'll go to the worldwide statistics and the U.S. statistics for the year 2020. We'll look at that in just a minute. So malaria, when I first started teaching, it was around 3 million deaths every year. And then later on, it was down to 1 million deaths. And I was like, woohoo, look at our accomplishments here, because we have really reduced the number of cases of malaria, or at least deaths by malaria. So cases are still there, but they're much lower, and the deaths because of malaria are much lower as well. And largely this is through preventative measures, keeping the mosquitoes out, because it's transmitted by a certain type of mosquito that is in tropical regions of the world around the equator, in equatorial regions. So there were down to 1 million, and then they were down to 750,000 in the last textbook, and now it's 450,000 every year. So that's still a lot. I'm not going to lie. In countries where they have malaria, this has an impact on their gross national product, or domestic product, their GNP or their GDP, about 1%. It has that much of an impact. Maybe not as much as it used to, but that plus AIDS, because some of these regions are dealing not only with malaria, but they're also dealing with AIDS. They are really impacted by these 2 diseases right here. But the prevention with bed nets has been a huge thing, providing bed nets for people. They're relatively inexpensive, like $10, but that's still too much for poor families that maybe only make $10 in a whole month, you know. So this is, that may be an exaggeration, but it's too much for families that are poor. And so providing those bed nets has been a huge thing. So the WNBA and the NBA did a campaign called Nothing But Nets. You know, like when you shoot a basketball and it doesn't hit the rim, it just goes through the net. So Nothing But Nets, and they provided a lot of bed nets for countries in Africa and around the world where they have a malaria problem. So infectious diseases are considered like new or emerging, as well as older, re-emerging. So the emerging diseases are ones that have come about in the last 30 or 40 years, like Ebola, AIDS, hepatitis C, viral encephalitis, and now we have to add COVID-19 to this. Re-emerging diseases like TB, syphilis, measles. We've seen some of the measles, even though it says it's down since 2015, we have seen outbreaks of measles because people are not getting vaccinated. Polio, leprosy, and parasitic worm diseases have been largely eradicated, and so we'll hope that they do not become a re-emerging disease, but some of these have re-emerged, and so tuberculosis, TB in particular, is a really good example of a re-emerging disease. So before the AIDS epidemic in 1980, we had almost eradicated tuberculosis worldwide. And then because TB is something that people who have AIDS cannot fight off, we have seen a huge increase in the number of people with AIDS and TB, and therefore they have it so they can give it to other people, and we don't vaccinate against it here in the United States, so they could still give it to other people in the United States. And this is largely, it's an issue of, it's an airborne disease, and when you have a lot of people like in the ghettos clustered together, somebody gets it, then everybody gets it because it's so contagious. So diseases that were once considered non-infectious, we're finding they're actually caused by microbes, so they are potentially infectious. So gastric ulcers caused by Helicobacter pylori, the link between certain cancers and bacteria and viruses in particular, are about 13 to 17% of the causes of cancer. The Coxsackie virus has been associated with diabetes and schizophrenia. So this is something that we would normally think, well, this is it's a psychological problem, but we're seeing now that it's actually a virus that's associated with it. And diabetes, we think of this as maybe just like a food problem, but again, it seems that a virus can trigger diabetes. And I don't know if this is type 1 or type 2, but again, there's some association between things that we used to think were not infectious. Multiple sclerosis, OCD, obsessive compulsive disorder, coronary artery disease, obesity, and a lot of other chronic medical conditions have been linked to then different microbial infections. So it's not something, once we figure out that the cause is actually microbial, sometimes the problem has already done the damage. Like multiple sclerosis has already destroyed some of the pathways, neural pathways, and they don't get remade. And coronary artery disease, once the damage has been done, the arteries may build new pathways around problematic arteries, but it is not something that you can really reverse. And obesity, same thing. It's harder for them to lose the weight once they've gained it. So it can be reversed somewhat if we figure out that it's a microbe, but it's not like it's going to be an easy fix. The subtler side of microbes, so like we're now seeing subtler side, so slow, quiet, destructive diseases that cause things like female infertility caused by chlamydia infection, and they may not have even known that they had it because it was probably asymptomatic. Liver disease like hepatitis C can be very silent until you start to have the liver cancer and see the symptoms of liver cancer. Cervical cancer caused by human papillomavirus. So again, these are things that we're finding that microorganisms do have an impact on and cause diseases that we wouldn't have thought of as microbial. So the weakened immune systems, so we're seeing a lot of people who have weakened immune systems and they're subject to all these microbes that, and we're seeing, well, because of HIV and because of AIDS and other like human transplants and things, we see a lot more people who are immunocompromised. So they're getting diseases that we wouldn't have seen 30, 40, 50 years ago. And now we're getting some of these different types of diseases, getting quite a few occurrences, and frequency has increased in some diseases that normally we wouldn't have seen because people with healthy immune system would have been able to fight it off. And we're seeing drug-resistant microbes that contribute to an increase in infectious disease. So the more microbes out there that are resistant to drugs, then we can't fight them off, and so we have the increased number of infectious disease. So when I first started teaching, I had never even heard of MRSA until I started teaching about 1999. And I don't think a lot of people, it wasn't something that was really in the public psyche, people just didn't know about it at the time. And now we've got pages and pages of microbes that are actually resistant to antibiotics. So we'll be talking about that when we get into chapter 12. But this would have been what I would have thought before COVID. I would have thought drug-resistant microbes would be the biggest issue that we're facing in that, and maybe Alzheimer's, and then COVID hit. So, all right. So section 4, concept check questions: true or false? All microbes cause disease. The second question: why is there a difference between the top 10 causes of death in the United States versus worldwide? And name 3 connections between diseases considered to be non-infectious and a microbe.